All right, ladies and gentlemen, good evening and welcome once again to our class, the Care Corner. And this is a platform where we meet every week to discuss issues pertaining to our health, but in particular with our mental health. So this evening, we are here once again to continue from where we left last week. We've started a series that is anxiety disorders series, and we've gone through all the anxiety disorders according to the DSM-5. That is a diagnostic statistical manual for diagnosing psychological conditions. And today we are finishing with selective mutism, and we'll continue with other forms of anxiety disorders which stand alone. They are not directly under the list of anxiety disorders as stated by the DSM-5 in that order, but we are going to take them one after the other. So we'll be looking at body dysmorphic disorder, and also, if we have the time, we'll look at obsessive compulsive disorder and things that it involves. So just as we used to do, I would like to start this evening's presentation on two scriptures. We are talking about issues surrounding anxiety, and today's talk falls more about how we perceive ourselves, especially talking about body dysmorphic disorder and then that of OCD. So I want us to ground our discussion today on these scriptures. The first one from Psalm 139, reading from 13 to 14. And it says, "For you created my innermost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that fully well." So this scripture is trying to let us understand that God has intentionally and carefully created us in ways that we are so unique. He has made us so wonderful, so beautiful, so handsome, right from ages. And he knows everything about us. He intentionally put everything at everywhere that is supposed to be. So he said that for you created my innermost being. Your innermost being, everything about you, physically, psychologically, emotionally, God has created you so. And he knit you together in your mom's womb. Because of that, I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that fully well. And then when you take Romans chapter 12, verse 2, it reads, "Do not conform to the patterns of this world, but be transformed by renewing your mind. Then you will be able to test and approve what God's will is. His good, pleasing, and perfect will." So many a times we become so stressed out just because of what society is expecting of us, and we tend to forget who we are. We tend to forget ourselves, and we are always trying to be like what society is expecting, or what people, sometimes it's not even people expecting, but what our mind tells us that the society is expecting. And based on that, we tend to go into a lot of stress, anxiety, and issues that make us unwell. So Romans 12:2 is telling us that we shouldn't conform to the patterns of this world. You are unique. You are special in your own way. But be transformed by the renewing of your mind. Then you'll be able to test and approve what God's will is. His good, pleasing, and perfect will. Every plan about you that God has made is good. how you are, God has created you in his own image, and it's in his image he created you. So there shouldn't be any situation whereby you feel as though you are not good or you do not deserve to be alive. So this evening, this is where I want us to lay the foundation for our discussion. The first major topic that we are looking at is just a completion of what we started over the weeks. So selective mutism. Selective mutism. What is selective mutism? So per definition, selective mutism is an anxiety disorder where a person is unable to speak in certain social situations despite being capable of speaking freely in other situations, such as at home with families. So this disorder is such a way that the individual in some selected situations, especially social situations, they find it difficult to speak. It is not by choice, or it is not their will not to speak, but they just have that intense anxiety, that fear to speak. And the words will just not come out. That's what the word selective. So selective mutism. It's an anxiety disorder where a person is unable to speak in certain social situations, despite being capable of speaking freely in others, such as home or with family. So the individual often feels a physical inability to speak due to anxiety or fear, which can manifest as a frozen expression, avoidance of eye contact, and using gestures to communicate. So let's take it that, for instance, a child, and mostly you can see this thing in children, but some adults also exhibit selective mutism. You should take note of that. So let's say this child, when playing with his or her friends in the community, at home, when it is break, like this child can speak, can talk, and can do everything as expected. But unfortunately, when this child goes to classroom or at church or any social situation where this child is expected to speak, automatically this child just freezes and cannot speak in that situation. Sometimes you may end up that you may either be using body languages, gestures to communicate what they want to communicate, but the words will just be difficult to come out. So sometimes based on that fear, they may tend to even avoid eye contact so that they are able to express themselves. So selective mutism, as I said earlier, is not a choice, and it can significantly affect a child's school and social life, often leading to mistaken beliefs that the child is simply shy or rude. So sometimes you are not careful. You may think the child is just lazy, shy, or the child is just not is just disrespectful, or the child is rude in situations like this. But the fact is that this child will actually wish to speak. So sometimes rather they are making the effort to say what you are expecting of them, but there's that intense fear, which makes them find it very, very difficult to speak in the situations. Sometimes it may be towards a particular person. It can either be an individual in that situation, in that social setting, that anytime that person comes in the picture, they find it difficult to express themselves. So there's some anxiety surrounding that figure or the situation at large. So they just find it difficult to speak. We appeal if we can mute so that the background interference. All right, thank you very much. So let's look at some symptoms when it comes to selective mutism. So, like as I said, inability to speak in specific situations, not all situations. So the difference is that it is not all situations that this person is not able to speak. They are just specific situations. So in other situations, the person can talk, do everything as expected of him or her. But when it comes to some particular situations, they are not able to do so. So the most prominent sign is speaking normally at home, but remaining silent or only using whispers in places like school, with strangers, when they meet people that they do not know, where that fear or anxiety start coming, then they just freeze and they're not able to talk. Some will automatically even be stammering, and the words will not even come out, but they are trying. You realize that they are trying to speak, but it's not coming. So they may end up using body language or gestures or whispers to communicate. It can either be at workplace. So maybe based on some anxiety, some fear around the work environment, this person who is expected to speak will just find it difficult to speak. And then there is that fear and anxiety. Individuals with selective mutism experience significant anxiety and fear in social situations where they are expected to speak. So the clause here is that the individual is expected to speak. If they know that they are not expected to speak and they are just there, they may not have any issue. Maybe it's a gathering, let's say at church, and the person knows that nobody's going to call him or her to pray, to do anything. They are there, they are fine. They can communicate with people around them that they feel comfortable. But where they know that maybe they'll be calling them out to either do something, that come out, read Bible, pray, do something, which they know that expectation is there. Then the fear comes. So you call the person and the person can't do what you're expecting them to do. And then when confronted with an anxiety-provoking situation, a person with selective mutism may appear frozen, tense, stiff, or have a blank facial expression. It means sometimes it can get to the point where they've been collapse. The person may just go blackout. And then most often in situations like that, they may use non-verbal forms of communication. So they may use other forms of communication to express themselves, such as nodding or shaking their heads, pointing at what they are trying to tell you about, or using gestures to really to communicate. But just for the words to come out from the mouth becomes very difficult in situations like that. So at worst, they'll withdraw. So the situation will make them to withdraw from social interaction, because based on that fear, it is better I don't even go to embarrass myself. So they may end up not going into situations like that. So mainly that is about selective mutism. And as usual, as we're talking about all the anxiety disorders, I think we've run through these causes and risk factors over and over and over. So we are saying that selective mutism sometimes can be as a result of genetic or biological factors, where there's that family history of a mental health issue that can translate into the offspring of those families. So the children and the individual, as a form of inherited gene or trait, may end up experiencing that. I mean, sometimes talking about family background, upbringing, maybe the kind of upbringing that this child experiences, where the child is being shut down with a little thing like shut the child down and not making them express themselves, or you associate some particular situations to terror to them. So as that associations are going, or that person, there's an association over there. So anytime whatever the association of terror comes to play, then it puts this fear in them. So with time, they may start having anxiety towards those events, to those people or things that bring about this fear into them. So sometimes upbringing, how we communicate to our children, the things we do, or even parents who exhibit things like that, they may pick it up. There's some psychological factors like the anxiety you're talking about. All those stuffs can bring about some of these conditions, environmental factors, and then sometimes combination of all these factors can bring about selective mutism. So this brings us to the end of the first series that we've been doing. Maybe let me pause, because we are starting a new set going from this place. So if anyone has any contribution, any question to ask before we move on to body dysmorphic disorder, the person can do so in few minutes, and then we go on. So if there are any questions, any contributions, please, you can raise your hand and you talk to us. Yes, Sally, please, your hand is up. You can speak to us.
Yes, thanks, John. Good evening. So, if you have a client like that before you suffering from or presenting with this kind of problem, how can you help the individual out? Thank you. Please, did you get my question?
Yes, very well. Yes, please.
Thank you.
Yes, so you're asking management factors for
Yes,
people
please.
who are experiencing situations like this. Yes, so management comes in different forms. So talking about the psychological support that you can give to the individual, first, we will have to take this child or the individual through assessment. Let us find out where the anxiety is coming from. And then, as we mentioned, as we are able to, we must first distinguish clearly that this person in other situations, they're able to speak well, or they're able to speak freely. But in some other situations, they find it difficult in doing so. So after you're able to ascertain that, and then you are sure that this is selective mutism, then you now bring in some behavior modifications or therapies over here. So let's say maybe it's a thought pattern that is, maybe there's a particular thought around the situation or the event that is making the individual find it difficult expressing themselves in situations like that. Then you may want to explore those thoughts and then to help restructure them. So maybe through a cognitive behavior therapy, you may be able to restructure these thoughts of the child or of the person, not necessarily a child. And then also teaching relaxation exercises is also very important in this situation. We're able to take the person through various forms of relaxation, mindfulness relaxation exercises, where they're able to, in situations where they feel tense or they feel anxious, they go through these relaxation exercises. And then also helping, trying to take them through uh, exercises or therapies that will help them take things one at a time so that they don't bulk situations up, and that will be provoking the fear or the anxiety towards them. So mostly, and then also maybe there may be other medical mental health conditions that may be a trigger or a source to that condition. So we explore and we find out, are there other mental health conditions that may be provoking this anxiety in the child? So if you should explore and realize that maybe there are some other mental health, some other anxiety disorders that are there, we also have to work on addressing those particular issues over there, and then you help the individual to come out of the situation. And then sometimes to even maybe try to expose this individual gradually, systematically, to whatever provokes them. So systematic desensitization therapies can also help individuals in this sense, where whatever the anxiety provoking stimulus is, you gradually expose them to it, and with time they get to adjust themselves to the situation. But mostly it's based on the thought pattern, the thought of situations like this. Maybe they feel uh, that low self-esteem or poor self-confidence in social situations. They may be having some body image issues. So based on that, they think they can't express themselves, or whatever they're going to say will be wrong. So we explore all these things and try to change those thought patterns for the individual. But most importantly, the relaxation exercises also help a lot, so that people who are in these situations, they're able to relax. You teach them how to relax well. If it is becoming severe, if it's severe, you may refer them to the psychiatrist or the mental health workers, nurses, psychiatric nurses, if available, to also support in medical treatment. So basically, this is what I would like to say, but I still open the floor. If somebody has another contribution to this, they can bring it up. Thank you. Sally, please, I hope I've answered your question. If there's any other question, please, you can put up your hand and ask, or we move on to the next presentation.
Hello.
Yes, hello.
I think I went off.
Oh, sorry. So you didn't hear what we
Yes, please.
said?
Yes, please. I was asking that what screening tools are available for, let's say, an 11-year-old who is presenting with this kind of disorder. Thank you.
Okay, well, so with this particular segment is really not uh, intended for, how do you call it, therapies. However, for Ghana Growth participants who we advocate that they should seek therapy or they should go for therapy in case they are going through any of these. However, assessment for anxiety related assessment can be used for children that may be going through situations like this. However, I think this very segment doesn't go more into the therapist work. So we will want to advocate that participants will seek professional help so that they are able to get their issues resolved. So when we holding maybe a training for therapists, we may go deeper and take step-by-step guides to help individuals with these situations. Thank you very much. Yes, I don't know if Reverend Awia want to speak.
No, please. No, please. Sorry.
All right, thank you very much.
No.
All right, so we moving to body dysmorphic disorder. What is body dysmorphic disorder? So as I said, it is also an anxiety disorder, but stands as a separate anxiety disorder. So when we talk of body dysmorphic disorder, it's also a mental health condition. It's a mental health condition in which you can't stop thinking, or the individual cannot stop thinking about one or more perceived defects or flaws in their appearance. A flaw that appears minor or can't be seen by others. So basically, with body dysmorphic disorder, the person suffering it perceives that some part of their body is not up to standard, or there's some defect at some specific part of the body, which to them is a whole deal. But the issue is that most at times that flaw that they are talking about may be very minute or very minor, may be something that is very insignificant. Sometimes other people cannot see what they are thinking, but to them, it is a whole deal that particular body part that is not up to standard must be fixed. And once it is not fixed, they are not fine. So they have different effects. Some will go into the various parts of the body that they may be thinking some of these things, but any part, it can be their shape, their breast, their face, their hips, anything, even their height sometimes, or their weight. They just feel like there's a defect or there's a flaw at this particular part of their bodies. So this preoccupation causes significant distress and impairment in social, occupational, or other important areas of function. So based on these thoughts that there is some defect at a particular body part, it affects their daily functioning. So how they're supposed to interact with people, go about doing their daily activities, their minds are occupied with these things. So their occupation, their workplaces, they're not able to go out to their workplaces. So let's assume this is somebody who works at the front desk and feels their face is not beautiful. You realize that when they go to work, they find it very difficult, or they may not even want to go at all. So, and it can affect other important areas of their functioning. So if someone is going through situations like this, it is necessary we look at it properly. Sometimes we just maybe brush it off, like, oh, this person is just maybe too low or something like that. But sometimes it may be a real deal that someone is going through. So individuals with body dysmorphic disorder may engage in repetitive behaviors, such as checking mirrors, grooming excessively, comparing their appearance to others, or seeking reassurance about their looks. So because of the perceived flaw in that particular body shape or body part, they are always looking into the mirror repeatedly. In a day, they can check the mirror a number of times to see whether the flaw that they are perceiving is real or not. So they engage in this repetitive behavior, checking, and sometimes doing things, grooming excessively, just to cover up the perceived flaw. Meanwhile, as I'm saying, what they are trying to cover may be very minute that people don't even take notice of that when they go out into public space. But to them, that thing must be fixed. And once it is not fixed and they are going out, they are not fine. So sometimes they may even avoid social situations due to this concern. So they may not want to go out where people will be looking at them, and to them, people will be judging them. Sometimes you see that they'll be comparing themselves to others excessively. Or one thing that can also help them sometimes is seeking reassurance about their look. So maybe if it is their partner, they'll keep asking their partner if they look good or if they are beautiful. So if they are getting these reassurances from people who matters to them most, that give them some relief or some comfort that, okay, then it is not bad. But within some time, the thought comes again that they are not fine or their body is not good. So if you can see the image on the slide, realize that this a lady who is seeing herself as, in quote, fat. Meanwhile, the individual in reality is not as bad as she is seeing herself, but to her, it is out of proportion. So that will keep her doing things that to bring her weight down. And this is also an anxiety disorder that affects people. So what do they do, basically? So constantly feeling or believing that there is something wrong with how they look. So there's that constant belief that how they look, there's a flaw or there's an issue with it. Seen as big flaws, things about your appearance that people don't notice or consider to be very minor. Trying to be sure about how you look. Example, frequently checking in the mirror. Planning or having treatment. So some people will spend a lot on cosmetic surgeries and everything, whatever they think. Sometimes maybe they feel their shape, their hip, their breast is not as it's supposed to be. So they may be spending a lot of money trying to fix this thing. And after fixing it, realize that it wouldn't even take much time and the anxiety starts again. Trying to hide features that the individual dislikes. Example, using clothing or makeups as camouflage. So maybe they think their face is not nice, so they'll do the makeup so excessively that sometimes it even goes overboard, just because they feel there's some flaw in their face. Or they will wear dresses that don't actually match, or the situation in which they are wearing those things actually doesn't really count or matters. Also, sometimes trying not to look at yourself because it feels upsetting. So like, for instance, the person who who is thinking that either he or she is growing fat, or the opposite, they think they are losing a lot of weight. So anytime they watch the mirror, they see this figure like this, it disturbs them. So better to make things better, I will not even look into the mirror for me to be seeing the flaws that are there. Because anytime they see it, it upsets them. So sometimes they avoid. But sometimes too, if they are, especially if they are trying to do something to correct it, they may end up looking into the mirror frequently, very frequently, to see if it is correcting. They avoid situations where people can see how they look. Example, where there are bright lights or lots of people around, rather they may want to avoid those places. So even in social settings, they may want to be at the back where nobody will see them. They want to be at the dark place. When they go to a place at night and there's bright light, they want to be at a place that is dark, that the spotlight will not come on them. Thinking a lot about how you look and why you look that way. And then sometimes judging how you look against certain standards. Example, comparing yourself with others or an ideal appearance. So the person thinks that to be beautiful, to be handsome, you must look like this figure. Then they are always comparing themselves. So once they do not look, they think they do not look like that, it becomes troubling to them. So what happens is that sometimes, so they may seek out numerous cosmetic procedures just to try to fix the perceived flaw. So for instance, the individual feels maybe their breast is not big enough. They will go for this silicone product just to wear and to give them the shape that they admire. And then sometimes it can be maybe they feel they don't have hips, so they'll go for hip pads and other stuff just to wear, to give them the shape that they think they need. Some people, there's a situation where the lady will wear oversized bra. Sometimes we put things inside, and because she feels that her breast is not big enough. So these are things that the person will do with the thought of fixing the flaw. But what happens is that afterwards, they may feel some temporal satisfaction if they're able to do these operations to themselves. They may get some satisfaction, or there'll be a reduction in the distress. But often anxiety returns, and when they may resume searching for other ways to fix them. So after they get, maybe they feel that, okay, if I go for a silicone breast, hip pad, or whatever, it will cover the flaw, and then this time around, there'll be no issues. They'll wear that 1 week. After a week, no, you feel like this thing cannot solve my problem. Please, let's mute our backgrounds if we are not speaking, please. Thank you. So after they've gone to fix the perceived flaw, within some short possible time, the thought comes back again, telling them that no, what they've done is not enough. So they will be looking for the next thing they can do. So they will spend a lot of money on this, and within 1 week, within 2 weeks of using that, they start having problems with it. They feel like, oh, maybe people are noticing that it is silicone I'm wearing. So based on that, they want to either go and do a surgery or something else. And then they start thinking of what next to do. So there's that strong belief that you have a defect in your appearance that makes you ugly or deformed. Believe that others take special notice of your appearance in a negative way or mock you. Attempting to hide perceived flaws with styling, makeups, or clothes. Constantly comparing your appearance with others. Frequently seeking reassurance about your appearance from others. And as you mentioned, seeking cosmetic procedures with little satisfaction. And then, most importantly, avoiding social situations, because the individual feels that some part of the body is just not as they expect it. So some common body parts that may be of concern. So it may be the face. Like their nose, the individual feels that their nose is too big. So either the nose is too big, too small, or the shape is just not nice. That's what the person feels. Anytime the person is walking, they are obsessed, like the thoughts of the shape of their nose is a trouble to them. So either they wear things, either mask to cover it, or do things that can cover the perceived flaw of the nose. Sometimes their complexion, they feel their body color or their skin color is not as it's supposed to be. So either that they will do things that to brighten their skin colors, body toning, and taking all sorts of medications just to change their complexion because they feel what they have is not the best or there's some problem with it. Sometimes if they feel that the body is wrinkled or wrinkles on the body, so it becomes a whole issue that will be disturbing them. Sometimes acnes or growths that may be on the skin. Sometimes even it's just one thing that is there, and not everybody is looking at it, but it is really a problem to them. So when they are in social settings, the attention is mostly over there, thinking that people are observing them. But it may be possible nobody even noticed that there's a spot on the skin like that. Sometimes it can be on the hair, about the hair. They think that their hairstyle or maybe the length of their hair is not good enough. So they will do things, buying expensive hairs, any other thing that they can just do to make their hairs feel good. Meanwhile, after doing that, it will be long and they feel what they've done is not enough. They want to do another thing again. We've mentioned breast size. And then with the men in particular, muzzle size. So they feel that their muzzle is not man enough. So they'll do things, gym, and all things that they could do just to get the body shape that they want. Sometimes even the genitalia. So maybe the man feels that his penis is not big enough, or it's too big, or it is not formed properly. So they take all sort of concoctions, anything that they can do to get the perceived size that they want. So a preoccupation with your body build being too small or too muscular enough, that's muscle dysmorphia, occurs almost exclusively in males. So we going to talk about the muscle, that one mostly it affects males in that situation. Sometimes it's about maybe having a pot belly, maybe it's normal, but the individual feels that no, the pot belly is too much. So anytime they see themselves in a mirror or in a picture, it's very upsetting. So they will avoid even taking pictures because they wouldn't want to be seeing those things over and over again. So the shame and embarrassment about the appearance may keep the individual from seeking treatment for the disorder because they feel even if they should come to the hospital or to see the therapist, they are going to expose their vulnerability. So that shame and embarrassment that the individual feels make it difficult to even go and seek the treatment that they need. So that is also one aspect of the condition, what it does. But we're saying here that if left untreated, it may get worse over time, leading to anxiety, extensive medical bills, severe depression, and even suicidal thoughts and behaviors. Body dysmorphic disorder usually doesn't get better on its own, so the individual will have to seek. So you have to seek help. You have to see a psychologist, see the psychiatrist, see any mental health worker. Let them take you through assessment, and then ascertain that this is the issue, and you are taking through appropriate therapies that will help. Some risk factors include So body dysmorphic disorders typically start in the early teenage years, where the individual is having that formation of their self, that's the self-image and all those stuff forming. And it affects both males and females, as we've rightly mentioned. Certain factors seems to increase the risk of developing or triggering body dysmorphic disorders, which include having blood relatives like family line or genetics. Maybe the person, a family relationship that may have either OCD or body dysmorphic, it can be a risk factor. Negative life experience such as childhood teasing. So when this child or families, friends are teasing the child about his or her body type, maybe in terms of insults, like, oh, look at your small head, look at your this, look at your that. All those things keep the child thinking that those parts of their bodies are not properly developed or they are flawed. So as the individual is growing, they become worried about those parts of their bodies. And sometimes that could be the genesis for the disorder coming through. Sometimes too, it can be based on personality trait. So people who are that perfectionists could be having those tendencies where they want everything of theirs to be as perfect as possible. Societal pressure or expectations of beauty. So let's say, for instance, maybe somebody who, I'm not saying people who are contesting for this beauty pageant, but mostly beauty pageant will expect to have a particular body shape. So if this person has interest in contesting for any of this pageantry in future, they may be doing everything possible to keep that particular body shape. So anytime the body shape is deviating from what they think should be the ideal body shape, it starts giving them some of these troubles. So as it persists like that, continues like that, they may develop some of these anxiety-related issues. So some societal pressures or expectations for beauty pageantry or what beauty is. And I think there are some pageantries that expect people to grow fat. So the heavier you become, like the more you win and all those stuff. So those ones too can be other contributing factors. Having another mental health condition such as anxiety or depression, which is not taken care of properly, can also be a contributing factor to some of these issues. When not taken care, or when not treated, or when not attended to, it can bring about low self-esteem to the individual because they'll feel not belonging, not involving enough. So they'll be seen as self-less. Social isolation or social withdrawals, because they think there's that flaw in their body parts. They may not want to go among where people are, where they are social gathering, because anytime they are there, they'll be checking themselves and it's like, no, they are not up to the standard of people expected there. It can lead to major depression or other mood disorders, suicidal thoughts or behaviors. Anxiety disorders, including social anxiety disorder and social phobia, can also be developed as a result of somebody who is experiencing these body dysmorphic issues. OCD, which is the next thing we're looking at, can also come up if body dysmorphic is not taken care of properly. Sometimes it can bring about eating disorders. So somebody who is so concerned about their body size, who feels they are putting on too much, or who feels they are losing weight. So either the person will tend to be eating less, anorexia nervosa or bulimia nervosa, any of them. So when this individual thinks that they are growing fat, they will be avoiding food. So they may not be eating properly and they may be losing the nutrient that they need, and other medical conditions may be coming up as a result of that. It means those who also think that maybe they are losing weight end up eating a lot, and if they are not careful, they even become obese. Some people may even eat to the extent that they will purge the food or take all sorts of medications just to throw out, so that because of the thought that if they eat too much, they will grow fat. So eating disorders may also arise. Substance use or misuse can also come up because this individual may be thinking that if they use this substance, it will help cover some of these flaws. And other health problems from behavior such as skin picking, hair pulling, and all those other issues may also come up. Physical pain or risk of disfigurement due to repeated surgical interventions. All these are complications that can come if body dysmorphic disorder is not taken care of properly. So when it comes to the treatment options, so both therapy and medication sometimes helps the individual. So what you should take, let's say, taking the therapy, cognitive behavior therapy, for instance, the therapy can focus on helping the individual to learn how negative thoughts, emotional reactions, and behavior can be causing this problem for them. So we help to change some of these ways that they think, challenge automatic negative thoughts about your body image, and learn more flexible ways of thinking. Then through that same therapy, you can learn alternate ways to handle the urge or rituals to help reduce mirror checking, reassurance seeking, or excess use of medical services. Then the same therapy can teach you other behaviors to improve your mental health, such as addressing social avoidance and increasing engagement with healthy support and activities. So if you see yourself or any close relation in any of these things, it is advisable to lead a person to seek treatment from a professional. They go to the hospital, they'll be taken through assessment appropriately. So once they are assessed, and you should know that the interventions is not one fit all. It is based on the individual's issue. And then severity as well, because some may be mild, moderate, severe. So based on what is actually the cause, what is causing those things. Sometimes the causes may be based on something that is real. Maybe something has happened to the individual and they were told something. Maybe they've gone to the hospital and the doctor made some pronouncements that, oh, because of this thing happening, it has led to this problem in your body. That word alone can preoccupy the individual, and they will never rest from it. So if you're able to identify the source of the problem, it also helps to know what form of intervention to give out to the person. So talking about lifestyle and home remedies, you're saying that stick to your treatment plan as you plan with your therapist and your medical practitioners. You stick to the treatment plan. And just as we are doing, you learn about the disorder so that you know that, okay, this thing that I've been doing, this thing that I've been going on in my life is not real, but it's as a result of this disorder. And then you pay attention to warning signs. What are the things that trigger you to start feeling the way you feel? You pay attention to them. Once you know them, it helps you to also manage the situations. And then if you go and see a therapist too, because you know your warning signs, they help you to put remedies to it. Practice learn strategies at home. Routinely practice the skill you learn during the therapy, so you become stronger. You become stronger habits. And then avoid use of drugs and alcohol. So just as we mentioned earlier, some people may tend to be using drugs or alcohol to cover some of these perceived flaws. If these things go like this, it rather compound or make the situations worse or difficult. It may bring about other mental health issues. So it is advisable to avoid using drugs and alcohol with the sense of reducing the anxiety that comes with that perceived flaw. And then get active. Physical activities and exercise can help manage many symptoms such as depression, stress, and anxiety. So you practice some of these things, relaxation, it helps. Consider walking, jogging. If you know how to swim, you swim, gardening, or taking up another form of physical activity you enjoy. However, avoid excessive exercise as a way to fix a perceived flaw. So if you think that there's a flaw, see a therapist. And then based on assessment, we see if it is actually a disorder or not. And then you are given the necessary help. So that will bring us to the end of body dysmorphic disorders. Let's see the time. Okay, so if there are any contributions, any questions, maybe two, and then we move on to the last part for the evening. Yes, please, if you have any contribution, any questions, kindly use the raise hand button and you will be called, or you can put it in the chat box as well, so that we can read out for you. Any questions from up to where we've gotten to now? If there are any questions or any contributions, please kindly unmute and ask. Okay, so I can't see any hands and there are no questions too in the chat box. So I think I will continue. Maybe when we are done with the next set, then we take all questions and contributions.
Hello.
Yeah, Alimatu, yes.
Hello.
Please.
Yes, please. Good evening to you.
Good
Thanks
evening.
very much. Yeah, thanks very much.
Yes.
I have a little contribution to
All
it.
right. All right.
Yeah, it's an example from my own home. My son is a bit fat. Then we call him, like, he hates the name Obolo. When you call him Obolo, he wouldn't talk to you. So I took him to my village, my community, and that was their first time seeing him. When they see him, they say, is that your child? I said, yes. Then they will ask, is he a boy or a girl? Because he has developed some breast and then some backside as a boy is abnormal too. So when they ask like that, they say, Mommy, what did they say? And me too, I'll tell them that they are asking whether you're a boy or a girl. Then the next day, I wanted to go out with these people. Let's go. He said, no, I will not go. I said, why? No, if I go out, they'll be asking whether I'm a boy or a girl, and I don't like that. And
Oh, we can't hear you. We've lost you. Alima.
yes, please. A call interrupted. I wanted to, hello.
Okay.
Yes. So sorry, I had a call. Throughout our stay over there, he refused to go out with me for rounds. So you see how it can affect the individual. And then my young girl is also the opposite. The boy likes food. He is somehow fat. The sister does not like food. Just this evening, she came and told me that, look at my belly. And I said, why? What is it? That is big, it's bloated. And I said, there's nothing wrong with it. You are just fine. And all the time, I try to reassure them that it's fine. And I told my boy, whilst at home, that, when a man is beautiful, they say he looks like a girl. So you are beautiful, you are handsome. You are nice looking. They admire you. And he said, no. But the way some of them will be calling him Obolono, he doesn't like it. So I understood him and I left him at home. So this girl is also saying that she doesn't want to eat too much because the stomach will be big. So this is just my little contribution. And on my side, I went for a program yesterday. I had this nail infection. So it's somehow weird. And whilst we were on the table, we were to eat. So I felt guilty. Nobody asked me anything, but I just told my colleagues around that, hey, I have a nail infection also. Then they said, oh, sorry. Meanwhile, nobody saw it, but to me, I thought somebody might have seen it and they'll be wondering what has happened to her finger. You understand? So this is just my little contribution and an example to what you were saying. So I really loved today's lecture so well. Thank you very much.
Thank you very much, Alima, for sharing that insightful experiences with us, at least making it clear to us that these issues are not just for the literature, but they exist and they are among us. So it is good we know about them. And if you think it is becoming severe, you seek help accordingly. Thank you very much for sharing those thoughts with us.
A pleasure.
Kofi Linus, I don't know if you want to speak to us. Your mic is on. Okay, I guess it's not intentional. Any other contribution or question? Okay, Innocent is asking for the slides. Okay, so we'll consider if we're able to finish the slides today, then we may share it. So you join the Care Corner platform and you get access to it. All right, thank you, Innocent. All right, so let's move on to, and I would like to appeal the person writing on our screen, if you can watch it and stop for us. Thank you. Yeah, so we want to look at obsessive compulsive disorder, which is also one of the anxiety-related conditions that make people worried a lot. So let us see what it is. So obsessive compulsive disorder features a pattern of unwanted thoughts and fears known as obsessions. So it's one of the mental health conditions. And what happens is that constantly there is that thought or that obsession, a thought of something wrong somewhere. So talking about features, a pattern of unwanted thoughts. So the thought that keeps coming, they are really not wanted, unwanted thoughts, known as obsessions. These obsessions lead to repetitive behaviors called compulsions. So the thought comes. When the thought comes, the individual feels like I'm supposed to do something in order to reduce the stress that comes with that thought. And that is compulsion. So the word or the disorder is two things in one. Obsession is that intruding thought, those thoughts that keeps coming over and over and over, the thought, that unwanted thought, that is the obsessions. Then the compulsion is the behavior, the things the individual do in order to reduce how they are feeling or the stress or the anxiety that is bringing to them. These obsessions and compulsions get in the way of daily activities and causes a lot of distress. So based on these thoughts unwanted thought that keeps coming, and then repetitive actions to reduce the anxiety, the stress that it brings about. Sometimes it can affect the individual's daily functioning. So maybe the person is supposed to get to work based on the thought of, let's say, the dress I'm wearing is not good enough, I've not locked my door, maybe all these thoughts coming like that, the person will be going back and forth, and it may affect the person's work. Even their relationship with other people can be affected. So ultimately, you feel driven to do compulsive acts to ease your stress. Even if you try to ignore or get rid of bothersome thought or urge, they keep coming back. So the thought that it is so serious to the extent that even if you intentionally want to ignore those thoughts by yourself, within minutes or within seconds, the thought comes back again. And you have to act. If you do not act on it, you don't feel fine. So this leads you to act based on rituals, and it goes in that vicious cycle. So the thought comes to mind. So this is the vicious cycle that it follows. The thought comes like you didn't do something, or something is wrong somewhere, or something is about to go bad. So the thought comes. So the thought comes following the stress or anxiety that comes after the thought. So let's say, for instance, the thought that your hands are contaminated because maybe you've touched a door knob that people have touched. So you think those who have gone ahead of you have contaminated that door. So when you touch it, you feel your hand is contaminated. Then it brings about some fear or some anxiety in you. And that is stressing you. So based on that, you want to go and wash your hand. And that is a compulsion in order to clean or to take away the germs that is in your hands. So that's the action that you are taking. So after washing the hands, you get some sort of relief that, okay, now my hands are fine. But within shortest time, the obsession comes again. Maybe you've got to touch something, it's like, oh, contamination again. Or even before you sit down, you feel the chair is contaminated. So you have to clean, use all the detergents before you sit. After sitting, after doing that, you get some relief, but within some time again, the thought comes back. So as you are saying, these are unwanted thoughts that keeps coming, and that is upset you.
Okay.
And as the thought comes like that, it makes you feel very uncomfortable.
Okay.
And that way of feeling is what leads you to perform the behavior that you perform just to get the relief.
No, anyhow. Yeah. Yes.
So let's look at, there are lots, but some literature, based on how they are looking at it, they take it as 4 common types, but there are lots. So we have some 4 types over here. First is what I just mentioned on the cleaning or contamination OCD. So this type involves obsessive fear of germs, death, or contamination, which leads the individual to engage in compulsive cleaning or avoidance behavior. So based on this, even talking about death, for instance, either they are sitting where they sit, their room, their chair, their office chair, their bed, they always feel like there's some death. So if they are washing, they take time to ensure that they wash very well. Their bed sheets are always the best point of neatness. if you see any little dirt in it, then that they can't use it again. It's because that's not what a clean person should be. Washing hands, because of the fear of the contamination or germs, you realize that they can wash their hands repeatedly, uncountable. They can even bath. They will bath maybe in the morning. After going out to do something, and come back to the house, they have to bath again because they feel like they've gone around. Germs have landed on their skin, or because they've sweat, or there's dirt on them. So they have to bath, do any form of cleaning. Their surfaces, they clean their surfaces, every place, because all the obsession is that there is some germs around, or there's some things that are contaminated. So their body itself or the environment in which they are is not clean. They can sweep. So especially if they're a compound house, for instance, somebody will go and wake up, sweep, wash the bathhouse. They'll come out and they feel the place that was swept is not clean enough. So they may want to clean again, or sweep again, or go and scrub again. So if you, as the co-tenant, do not understand this person, you take grudges with them. And why will I finish sweeping or scrubbing, and you come and take broom and do the same thing again? But if they do not do that, they will not be fine. So that's the compulsion. So the compulsion is that they'll have to perform the act of cleaning before they can get some relief. If they should bath in it without scrubbing again, they'll not feel fine. They'll feel the body is contaminated. So even the bathing that they bath, there's no use, or there's no need for even bathing. So they'll have to clean the place first before they can feel comfortable. So that is on the cleaning and then the contamination OCD. Then we have the symmetry or the orderliness. People with this subtype have obsession related to achieving perfection, symmetry, or exactness. They want things to be arranged in order. They want their things to be arranged in order that it's supposed to be. If it is, let's say, how they arrange their books in their office, on their shelves, whatever it is, they must be in that order. Even their shirts, how they iron their shirts with the lines in there, it must be that way exactly at all times. But one thing about this is that they expect people to also do those things. So because of the perfectionist tendencies, they expect others to also be like them. So if they are not doing things like them, they become uncomfortable. They will expect you to also be doing things like them. And you may be having issues with them. So even in terms of counting, so these people may count money over and over and over again, thinking that it's not up to. They'll finish counting, and in the next minute, they'll go and check it again to see if it is up to. Because of that, they want things to be in the exact way it is. So let's say, for instance, maybe this person is used to pressing their toothpaste from the bottom up onto the toothbrush. So if someone else come and then presses from the middle and they see like that, yeah, they feel very, very uncomfortable. So they'll have to go and reshape it to be in that order before they are fine. Because the thing must be the way it is. If they put this here and you move it to this place, they are not comfortable. So they keep arranging and organizing items to meet these standards, the standard that they have formed for themselves. So going into a house of somebody with this condition, actually the place will be hygienic. That's a positive. That's one positive about it, but it is just done overly. Because talking of hygiene, it's a top notch over here. But they overly do these things, and that is where it affects their daily functioning. Because this person can spend a whole day cleaning. This person can spend a whole day arranging or organizing things. Then we also have that of the harm of OCD. So that's an individual with this harm OCD experiences distressing thoughts or fear about causing harm to themselves or others. So the thought keeps coming that maybe what they are doing is causing harm to someone else or another person. Maybe as they are driving, they feel that they may go and bump into someone and maybe hit the person. So the fear of killing others with their car will may either prevent them from even driving. So they are always checking their selves to ensure that whatever they are doing is in place. They are not harming anybody. Before they speak, they think through their words over and over and make sure that the words they say do not affect anybody. So before they come to public to speak, it takes them a great deal of time to rehearse to ensure that their words meet standard. And you will not get it wrong. You will not get it wrong. That we will make sure that if by any means they go contrary to what they want to do, it makes them very uncomfortable. So they'll do things to ensure that no harm is happening to them, they themselves or other people. Then we also have that of the hoarding OCD. So this involves difficulty discarding possessions. So this person has gone to buy maybe a TV set that has that came in the box and all those stuff. After taking out the TV, the box that they're supposed to discard, it's difficult to do, so they can't do that. They finish using the canned milk, the Milo, and whatsoever, which they don't need those cans again, but they end up using them to decorate there. And woe betides you to go and throw some of them away. They actually don't have any use for them, but they just find it difficult discarding. So the deodorant containers and the perfume and all those stuff, you go and the bottles are still there, empty. They just find it difficult to discard these things, even when they have no practical value. This can lead to excessive clutter and a reluctance to part with these items. And sometimes it can be so bad that maybe their garage, you go to their garage and there are a lot of things that they don't need, which they could have disposed of. These things have been there years, but they just find it difficult to dispose them of. So they'll be there and rust and rust and rust and rust. Sometimes they even find it difficult to get space because the things will be adding up to the extent that there's no space this time around to even add on more. So this is some forms of. Then if you should take some of the same things specifically, like I mentioned, counting, tapping or repeating specific words silently. So as they are counting, maybe money, or they are not necessarily just money, anything that they're supposed to count to ensure that it is up to a particular number, they will finish counting. In few minutes, the thought comes that no, what you counted is not up to. So they'll have to go back and go and count again. They're going to go and check again. So they'll be repeating these things. And sometimes after counting, they'll be repeating the words in their head. Silently, yes, it is 50, 50. So they keep mentioning 50, 50 like that, repeating, and then be tapping their hands or their toes or their whatever. Then fear of contamination, germs, or illness. We've mentioned that. Concern with symmetry, that is orderliness. So things must be in the exact order as always that they expect, or exactness. We've mentioned that. Intrusive sexual or taboo thoughts. So sometimes they are there and thought around sexuality comes and like, and most of these ones, they are around what we call the religious OCD, where this individual sees that those thoughts are sinful. So when those thoughts of sexuality or some taboos come to mind, they feel uncomfortable. So they actually don't want, so they may do things, either avoid situations where those thoughts will be coming, but the thought will keep coming. So intrusive sexual or taboo thoughts keep coming. Excessive hand washing, as we've mentioned, cleaning or grooming, arranging items, objects in precise manner, seeking reassurance from others, and the list is on and on and on. This individual will go out, like the checking behavior, for instance, will lock the door, carry the key along. In the halfway their journey, they feel they haven't locked the door properly. So they'll, whatever they are, they'll come back to come and check if the door is locked. They, after confirming, they are going and the thought comes again. So they can be going, doing this back and forth. The person has finished cooking, turn off the gas, gone into the room, and feels they've not turned it off. So they'll go back to go and check again. Within some time, they'll go back again. If they do not go back, they'll feel uncomfortable because it makes them feel like, no, something will be happening. Either the house is going to burn if they do not go. And the same way with the cleaning aspect, as we said, they can change clothes multiple times in a day because they feel like either there's some dirt on it. And like, and when children are having some of these things, sometimes it can be difficult. If they see a little dirt in their dress, on their socks, or they will tell you nowhere to go. They feel like there are germs that is on it. So with the compulsion, OCD compulsions are repetitive behaviors that we mentioned that you feel driven to do. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsession or prevent something bad from happening. But taking part in the compulsion brings no pleasure and may offer only limited relief from anxiety. So after doing the thing, you may just get some relief, but within some time, the thought comes back again. So the cycle continues. So the individual in the day can go through this cycle a number of times. The obsession will come, the anxiety follows, then they have to do the act or the compulsion. They get relief. Within time, the thought comes again. So the cycle continues like that. So you may make up rules or rituals to follow that help control your anxiety when you are having obsessive thoughts. These compulsions are beyond reasons and often don't relate to the issue they are intended to fix. So like we've mentioned some of the examples of the compulsive symptoms, hand washing until your skin becomes raw. Sometimes the person can wash their hands, wash to the extent that sometimes you can see that the hands are suffering. Checking doors over and over again to make sure they are locked. Checking the stove over and over again to ensure they are off. Counting in certain pattern. Silently repeating a prayer, words or phrase. Trying to replace a bad thought with a good one. Arranging your canned goods to face the same way. So the way the Milo things are arranged with the names, like how they do it on the shelves at the supermarket. Yeah, so in the room, the things must be arranged that way. Whatever it is, they must be arranged in a particular order. If the person do not arrange them like that and you turn it upside down, there's trouble. And sometimes it can bring a lot of complications, especially when it comes to relationships. Because if your partner is experiencing some of these things, maybe especially with the cleaning and the dirt one. So you've cleaned the room, mopped every place, cleaned center table, everything. This person comes and feels that the center table that you've cleaned is not clean enough. So they may want to clean it again. And if you're not careful, you start taking grudges with this individual. At workplace with work colleagues, and it is always as if they are not doing something right. Meanwhile, it is a person that is experiencing this thing, which the obsessions, and it will be looking like people are the cause of his or her problems. So some risk factors, as usual, family history can be there. But sometimes, you see, if you live with a relative who has this tendency and you grow up with a person, there is that possibility of learning or acquiring that as a means of the environmental situation that you find yourself in. So maybe your mom or your dad has this situation and they are always cleaning excessively, you grow and think that is the best way of doing things. So you always be cleaning excessively. So sometimes the family history can be a contributing factor. So having parents or other family members with the disorder can raise your risk of getting OCD. Stressful life events. If you've gone through traumatic or stressful event, your risk may increase. So these reactions may cause the intrusive thoughts, rituals, and emotional distress seen in OCD. Other mental health disorders can also be contributing factors to OCD. So OCD may be related to other mental health disorders such as anxiety disorders, depression, substance use, autistic disorders, among others. Complications, as I've already mentioned, excessive time spent taking part in ritualistic behaviors. So the person use a chunk of their time in performing the rituals that want to help them manage their anxieties. Health issues such as contact dermatitis from frequent hand washing. So other health issues may be coming up from the rituals that they do. Having a hard time going to work or school or taking part in social activities. Trouble relationship or marriages. Poor quality of life. Because the person, almost every day in his or her life, there is this fear, anxiety in them that they must do something to feel relief. So they will not enjoy life as expected. Sometimes it can be so bad that thought of suicide and behaviors related to suicide may be coming up in the individual. So as usual, treatment options include can include medications and psychotherapy or a combination of the two. So based on the specific kind of sessions that you do have, your therapist will also develop therapy that will be aligned in helping the individual. And most of these anxiety issues stem from the mindset or the thoughts about the situation. So one of the fundamental therapies will be focused on changing the individual's way of seeing things, and then also putting in some behavior therapies that can help the individual cope or manage the situations. And then in situations to some anxiety medication, antidepressants can also help the individual to cope with the management. So you see the therapist, and then treatment is planned based on your needs. So, ladies and gentlemen, I want to end by reading this verse again, 3 John chapter 1, verse 2. And that it says, "Dear friends, I pray that you may enjoy good health, and that all may go well with you, even as your soul is getting along well. Amen." My name is Kwesi Tagbor. You may. So now, in the next 5 minutes, you want to interact. Your questions, contributions are welcome. Thank you. Please, if you want to speak, you can just raise your hand and you'll be called. Questions, contributions. And this brings us to the end of our anxiety series. Or what have you learned? If you don't have a question, what have you learned? What do you want to share from, since I think about a month ago when we started our discussion. What have you learned? What do you want to share with us? Any experiences? Let's hear from you. Let's get interactive. I also want to remind you that this is a Ghana Growth Project, an initiative of Springboard Foundation, Springboard Roadshow Foundation, with support from Mastercard Foundation and then the Ghana Psychological Association. Okay, so in the chat box, Zoom user, he said, how would you tell if a hoarding disorder is anxiety related? Is there a different hoarding disorder and then the OCD related one? So what brings the anxiety issue here is when the individual want to discard the thing that they are hoarding, it becomes difficult for them. They feel uncomfortable. Even if someone else is taking that thing away from them, they feel that they will need the thing. So that is where the anxiety comes from. So if the individual hoards, so the hoarding here is not, we are not saying it in the economic terms as in based on price differentials, the individual want to put things down and the price appreciate for them to sell. No, that is what we're talking about. But this hoarding here is about items that the individual do not really need, do not have any use for, but they keep them and they find it difficult to discard. That is where the problem is when it comes to the hoarding disorder. So the person has gone to, let's imagine, the person has gone to buy a deodorant, have finished using it. The bottle, the person will obviously not use it for anything, but they've left it in the room. They bought another one, finished, and they left it. Just to throw it away is difficult for them. They bought canned, maybe canned Milo or whatsoever. They finish using them. They've left it in their room. They bought this oil, cooking vegetable oil. They finish using the gallons and they keep packing them in there. So this is the hoarding you are talking about. And sometimes it becomes so bad that their rooms become so clumsy where they are not able to even have space for some things again, but just to discard these things is difficult. So that is where the anxiety comes, or the hoarding becomes an anxiety-provoking thing with them. And as we said, the compulsion here is that they have to make sure that they keep the thing, because the thought is telling them that this thing will be useful. When they discard it or when they throw it away, they feel like they are throwing some valuable thing away. So they will have to go and take the thing. Until they get it back, they don't feel fine. So that is Zoom user. I don't know if I've explained better, or you can unmute and clarify the question if I didn't get it for you very well. Thank you. But please, if any other person has any contribution to his question to you, can do so, and other contributions are equally expected. Thank you. Okay, so Deborah is asking, at what point does anxiety disorder need treatment? So I think right from the beginning, as we say, when it's affecting your daily functioning, once the anxiety-provoking stimulus is affecting your daily functioning, you're not able to function at your optimal level based on that perceived fear, you have to seek treatment. So it is based on assessment from the therapist that will tell that, oh, okay, maybe based on the duration, this maybe is normal or it is not normal. But if you realize that this thing is affecting you, your relationship with others, your output, your work, your daily, everything, your daily living, then you should be seeking treatment, because some of them, based on the literature, some will tell you that 6 months, some will tell you 4 weeks, some will tell you 2 weeks of experiencing that repeated pattern. So anxiety disorders in general have durations, some six months, some 4 weeks. So it depends on the assessment that we can ascertain that this is a disorder. So once you feel uncomfortable with a particular thing, and you're not even too sure, then you have to seek help. And then as we started from the beginning, we've mentioned a number of anxiety disorders. We've mentioned that of generalized anxiety disorder, where you say that a person has the anxiety, there's a fear about almost everything about their life, various aspects of their lives. So there's issues around maybe their job, their relationship, their children, finances, their health, all to one person having issues around all these situations can be seen to be a generalized sort of anxiety. We spoke about panic disorders as well. We mentioned other forms of anxiety, and today we look at that of selective mutism. We looked at separation anxiety last week. We look at specific phobias as well. So all for anxiety issues, there are a lot. And those who have been with us from the beginning, you attested that we look at a lot of issues when it comes to anxiety. So when to seek treatment, once it is affecting your daily functioning, it is good to seek help, so that based on assessment from your therapist, they'll know how best to help you. And then say, please, what of those who buy things unnecessarily? And so sometimes impulse buying, so yes, they can be. Sometimes people buy things that they don't usually need. Some it can be around these issues of anxiety-related issues. But with those ones, you also have to look at it very well before we're able to tell that this is a disorder or not. Any other question there? Please, if you want to speak, you can unmute and speak to us. Okay, the floor is open for interactions. So talking about the buying unnecessarily too, there is a condition known as compulsive buying disorder or compulsive shopping disorder. Sometimes too, it's form of some of these addiction issues. So you realize that the people buy things unnecessarily, often to the point of financial distress that comes there, and they don't really have control over the things they buy. So when you're talking about the compulsive buying disorders, these are some of the things that come up. Feeling unable to resist the urge to buy something. Once they see the thing, there's that strong urge to buy it, even when they don't really need the thing. Even if they can't afford it, try looking for money to go and get the thing that they've seen. And if they don't get the things there, they are not comfortable. they are not comfortable at all. They become, sometimes they may feel guilty or ashamed that they are not able to buy the thing. So yes, you have situations like that. Innocent, I see woman. Please unmute and speak to us.
Yeah, good evening. Please, there are questions in the chat box, so kindly visit there.
Okay, Zoom user. What medications are usually recommended, and when would you know medication is needed for your client? Well, so when it comes to medication, there are some symptoms. Let's say if this anxiety-provoking stimulus is as a result of, let's say, a psychotic symptom. If I'm talking about psychotic symptoms, talking about the individual either having hallucinations that is some false sensual perceptions. The person is hearing voices that are telling him or her to do the things they are doing, or they are seeing some things that are bringing about. They are seeing some images that are bringing this anxious feeling, or they are having some strong false beliefs, which we call as which attempt delusions. And these things can be these things can be triggers to the fear or the anxiety the person is having. Let's say, for instance, you are hearing voices telling you that be careful, or they are warning, a voice warning you that do this, do that, do this, do that. So the person, like, let's say, for example, the repetitive behaviors are based on the voices that they are hearing. Situations like this, it is medicine that will have to take off. So you have to refer to the psychiatrist. So you refer to the psychiatrist for them to prescribe medications appropriately to take care of those psychotic symptoms. So the point where you recommend the treatment or medication is if you realize that the psychotherapy is really not forthcoming. But if you should do a very good assessment, through the assessment, you get to know that there are psychotic things that are present, or maybe there are some other mental health conditions, like, let's say, depression. The person is depressed, and based on the depression, it's making them feel or think in a particular way. So if that depression is supposed to be if it is clinical depression or major depression, medication may be needed to support the way the person is feeling. So you recommend as such. And then talking about the medications, as I said, appropriate, sometimes anti-anxiety medications may be given, or antidepressants may be given based on the individual need. So that is where you recommend medication. So medication is basically mainly on the form of assessment that you take, especially your intake, and then other mental status examination that you do will tell you if the individual will need medication or not. But it's not all instances where the individual may need medication, but sometimes you have to do the two. How will you deal or manage a supervisor or superior in an office with OCD? The best is to lead the person to seek therapy or to seek help, because the individual may not even see whatever they do as a problem. So you have to, until education is given and the person gets educated, they will not know that what they are doing is a problem. So you have to provide what they call psychoeducation to the person, let the person know that symptoms like this sometimes are mental health related. So you may seek help. And you have to approach, you see, like as I said, this is your superior. So you cannot just go in front of the person and say that, I think you have OCD. No. So you have to find a way to get closer to this individual. So through your conversations, you can make the person understand that this is, maybe you've learned things like this, or if possible, invite a mental health or a psychologist to come and give education at your workplace on a topic like this. So through hearing some of these things, the individual will see him or herself and maybe will move forward to seek help. But you can't just stand up and say that you have this condition, especially with your boss. If you're not careful, though, you'll be sacked. So these things have to be done with care. But I think the best is get closer to the individual and let the person seek help. Let the person see the need for help. But let them know that you've studied something like this, and maybe based on some patterns of behavior that you see, the person he or she may seek help. But I think with this one, let me open it for us all to deliberate about it. Maybe someone else may have a good way of approaching it. So please feel free and let us help respond to Innocent's question. How will you deal with or manage a supervisor or superior in an office with OCD? It is open for discussion. Alimatu, your hand is up. Please, you can talk to us.
Thank you. Please, I want to add up that mostly menopausal women, they go through most of these symptoms. And sometimes it's difficult for you to counsel them. So what one can do to manage the situation is to talk to the people that they are staying with. If you are the subordinate and the person is the boss at the office, you just have to understand that that is their situation or the situation that they have found themselves. These are part of it, and then you have to ignore and understand them as such. In the house situation, I have another example where I visited an auntie, and then it's like they made the house help there, whatever she does, my auntie is not satisfied. She's somebody that her neatness level is extra O. So when I was going out of the house, I called the girl, told her that that is how auntie is, and then looking at where she has reached menopause and then a whole lot of things. So you just have to manage her, understand her. When she shouts at you, you do something and she says it's not well done, just understand her and then do it again. It's not that she doesn't like you, but it's her condition. So I've realized that we women, when we reach that stage, we tend to do most of these things. Thank you.
All right. Thank you very much. Yes, please, any other contribution from any other person? How will you manage your superior who is having OCD? Okay, so one thing to that I want to ask or add on to is that, you see, once you have identified that the person is suffering this condition, then you should know that what they are doing is not really them, but it's based on the condition. So you should understand them. I think once you understand them, you will no longer be getting angry or upset like you used to do. So understanding the condition and knowing the symptoms will help you, the person living with the superior who has that tendency, manage yourself so that you will not be feeling the stress from the person's behaviors. So you know about it. So you have to help yourself and not necessarily helping the person. But if you have the chance to help the person or leading the person to seeking help, you do. But understanding and then setting your own boundaries and communicating clearly can help the whole situation. And I think that will also answer the last question in the chat box, which is saying, how can children deal with parents who have OCD? It's just like a superior who has the condition. So I think the children should first know about the condition, educate yourself about it, and then you tend to understand the parents in that direction. once you understand them, it helps you cope or manage them. And know that whatever they are doing is not really who they are, but it's as a result of the condition that they are suffering. Then you encourage them to seek help appropriately, or help them get education about some of these things. Sometimes because they don't know that this is a problem. So you who have the knowledge, you have to share with these people or with your parents so that they seek the help that is needed. But we should also understand sometimes these things too can be personality issues. Okay, sometimes these things can be personality issues. So as somebody who, let's say, is a narcissist, and then, somebody who is a narcissist, for instance, will have that perfectionist tendency and will always want to lord over people. People should do things their own way. They don't really care about others and all those stuff. So if this person has these tendencies, they may always also want to get their people to do things in a particular way for them, and they may end up stressing you. So I think, and even the borderline personality disorders, or some of these disorders can equally be contributing factors to anxiety issues. So let us encourage people to seek help. And if you are on the call with us and you see yourself, don't feel shy. At Ghana Grows, we have early psychologists who you can always reach out to. We have a toll-free number, and I'm sure Madam Claudia will share the toll-free number in the chat box, where you can always call. You can always call, and you get a therapist who is always on standby. Aside that too, we also have okay, so let me mention the Ghana Grows toll-free number for you in case you need to see any therapist. You get a free service. Just call and talk to the person. So 030-8255-775. 030-8255-775. So that's Ghana Grows toll-free number. When you call, you'll be connected to the psychologist on the program, and you'll be given the necessary help that you need for free. So feel free and call the number. You can also join the platform, the Care Corner platform, and we are always open. Anytime, put your concerns there, and it will be discussed, or we'll look at it. So the platform is for us to interact. So you can always, so I also seek the indulgence of Madam Claudia to also share the link to the Care Corner platform, where people can join and get solutions anytime they need. Kofi Lenos is asking, if someone doesn't want to accept that he or she has OCD, what can one do to handle such situation? Yes, so there's one thing. If it is you with a person who have to help yourself in this situation, how do you live with a person like that? How do you cope with a person who has a condition like that? Because the individual, one, is also not going to seek therapy. So you have to adjust yourself to live with a person like that. Know that whatever is happening or whatever they are doing is as a result of the condition. And I think once you know that, it helps you to manage the person appropriately. But maybe with time, and also I think the approach we use in talking to the person also matters. Okay, when you are making it look like the person is sick, at times, when you talk of issues of mental health, some stigma sort of is attached to it. So let us make room for open conversation about some of these things. And let us also learn to understand some of the, mostly people who experience some of these things see it to be very normal, or a normal condition, or normal way of living. So if someone should tell you that they are realizing that maybe how they know you, there is some deviation or something like that, I think instead of rubbishing what the person is saying, let us take time to reflect. Let's take time to reflect in ourselves to see maybe seeking help, going through assessment will help you. But we shouldn't just rubbish everything that people say to us and think a person is just trying to insult us or to demean us or something like that. So I think that can be helpful. If not, mostly we'll be suffering issues and we can't get the help that is needed. But if you are talking to someone, a person doesn't want to accept that they have a problem, you have to manage yourself. Find ways of coping with the person. If it is necessary to continue to be with the person, you have to find ways to cope with the person. I think that is what is appropriate for us to do. But all the same, if anybody have any contribution to this very one, I think you can share your view. The WhatsApp platform link has been shared in the chat. You can click on it and join the platform. If you have any concerns, you can put it there. The recordings and slides will be shared over there as well. So this brings us to the end of the anxiety series. Hopefully next week we'll continue with a new presentation outside anxiety disorders. So we look forward to seeing all of you same time next week. Currently there are no hands up. And I've also taken notice of the thank you messages in the chat box. Insightful presentation. Well done, Esther. Esther Ikriabuaji, I've seen you. Yes. And then let me also acknowledge everybody who has made time to join us. Madam Deborah Govano, as always. Emmanuel Dakwa, thanks for joining today. I think I'm going to find trouble for myself by mentioning everybody. June Okran, you are welcome. Reverend Sister Helena, and every other person. And then let me mention my mother, Stella Donko. Thank you for joining. All right, so on these notes, in the absence of Michael Ediye, please, do you want to talk to us? All right, so in absence of any contributions, questions, we would like to end today's session over here. And it is my prayer that the good Lord will take care of everybody throughout the week. And shall you not be blamed in any situation? Shall you not befall any temptations? Everything should go well for you. If there is any fear in anybody, any anxiety in anybody, it is my prayer that God will comfort the person. And as the last scripture that I read says, it says that, dear friends, I pray that you may enjoy good health. So I wish good health for everybody. Throughout the week, everybody should be in good health. When we meet next week, everybody should testify that they have been good. And everything should go well with your soul, just as you are doing now. So thank you and have a good evening. Bye-bye.
Rajos,
Madam
good
Stella,
evening.
good evening.
Good evening. Oh. Thanks for the good work.
You are most welcome.
I appreciate all. I heard my name. Thank you so much.
You are most welcome.
Yeah, okay.